Signs and symptoms of embryo implantation. After the sperm fertilizes the egg in the fallopian tube, a process known as conception or fertilization, a mass of organized cells called the blastocyst travels down toward the uterus. Once in the uterus, this little amount of multiplying cells has to attach or implant into the uterine wall. This embryo stage is known as implantation. At this moment, around 7 days after conception, the blood levels of pregnancy hormones, such as the human gonadotropin, starts to increase. If, for any reason, implantation doesn't happen at this time, your uterine lining will shed in your normal monthly period, preparing your uterus to the next try. But if the implantation succeeds, the pregnancy hormones will stimulate the development of the embryo and the uterine lining to support your pregnancy. When you are expecting to be pregnant, it's natural to be aware of your body changes, no matter how small it is. However, remember that the lack of symptoms doesn't mean you are not pregnant. Most women experience no signs at all of implantation. So, before we highlight some symptoms you might observe if implantation has taken place, keep this advice into your mind. Having the following symptoms shared here doesn't necessarily mean you are pregnant, and having no symptoms doesn't necessarily mean you are not. Let's take a look at them. Embryo implantation is one of the causes of first trimester bleeding. This bleeding can be confused with your menstrual bleeding because it may happen around the time you was expecting your menstruation. However, most commonly, the implantation bleeding occurs few days or even a week before your menstrual period. Besides of that, another difference from the implantation bleeding is that it is more a spotting than an actual blood flow and is most likely to be a light pink or brown, as opposed to bright or dark red of your period. The increase in pregnancy hormones allied to the fast growing of the implanted egg in uterine wall will stimulate the uterus to contract. This uterine contraction may be clinically felt by abdominal tenderness, lower back pain, or cramping around the time of implantation. Your digestive system may slow down and give you a bloating sensation due to the rising level of progesterone, which happens in an early pregnancy. Guess what? This same hormone also rises when your period is imminent, so this feeling can be a such common symptom of your menstrual period. After implantation, the rising levels of pregnancy hormones may cause your cervical mucus to become thicker, more plenty and white or yellow in color. It is worth to say that changes in your cervical mucus can be expected in many different scenarios beyond pregnancy, such as stress, sexual intercourse, or even your period, and may not be a reliable indicator of whether or not implantation has occurred.